Alright, welcome back guys. We are doing the tibia and the fibula. They're relatively short lists. So your tibia is obviously looking at these two, the weight-bearing bone of your leg. I actually know somebody who broke his fibula and walked and skied on it for, I don't know, a couple months before he even knew it was broken. You can function very well with a broken fibula. With broken tibia, not so much. You're not really moving around very much. Alright, so our first couple, the medial and lateral condyle. So on the tibia, it's actually on the proximal end rather than the distal, kind of a change of from what we're used to. So the tibia is on the medial side of your leg, and the way that so I should really kind of have these, no, never mind, we're fine. So this guy right here is going to make the inside knob on your ankle, so this is the medial side. So this is going to be your medial condyle and then your lateral condyle. The next one is your intercondylar eminence. So it is these bumps, these protrusions up here between the condyles. These guys do have functions. They keep the cruciate ligaments in their correct orientation. And we will go over the cruciate ligaments when we get to the knee joint. The next one is the tibial tuberosity, and that's this giant knob up here. This is the, really it's where the patellar ligament attaches, but by extension it's where the quadriceps muscles attach. So the bigger quadriceps muscles you have, the bigger tibial tuberosity you'll have. So one way that they can tell what people did, what their occupation was from ancient bones, is by looking at this. Like if they had really big ones, then they probably worked out in the fields and whatnot. The next one is the medial malleolus, which we use down here to determine if it was lateral or medial. And so this is going to be the medial malleolus. We might as well jump to the fibula, and that's this guy over here is the lateral malleolus. So this is going to make your outside ankle knob. Then you have the head of the fibula up here. The fibula only has two terms, right? The one end and the other. So the more narrow and pointy end is going to be the malleolus, and then the more flat, roundish end is going to be your the head of the fibula. And that looks like it's it for this section.